Do medical providers, doctors, PAs, nurse practitioners, everyone above and below, do they know how to take care of the LGBTQ populations? Have they been trained on how to do it? What unique needs we may have? Or are they out to get us? Are they biased? What's going on? Hey guys, welcome to my channel. If it's your first time, my name is Jonathan Lucero McKinney and I am a first-year physician assistant student and I'm passionate about LGBTQ health. Each week I try to cover a topic as it relates to my studies in school, do some additional research, and see how it uniquely affects the LGBTQ community. I'm really into today's topic. It is about the cultural awareness of LGBTQ patients, and specifically the journal publication I chose looks at oncologists, so cancer providers. The journal title is Web-Based LGBT Cultural Competency Training Interventions for Oncologists, a Pilot Study and the Results. And it's written by Shea and colleagues in the journal Cancer. All right, LGBTQ education about patients and the unique concerns that they have is really lacking in general medical education. As you rise up through graduate school or your medical training, your residency, fellowships, and beyond, there's really not too much cultural awareness training about our specific issues, despite it being strongly recommended by a number of professional organizations, such as Institutes of Medicine, the American Association of Medical Colleges, the National Institute of Health, and the Joint Commission all strongly recommend training more about LGBT patients. Of course, depending on the type of medicine that a provider ends up going into, whether it's family care, emergency medicine, oncology, or surgery, something like that, your training may be tailored to that specific discipline. But unfortunately, we've dropped the ball at training early and often. That's in medical school and in graduate school. The amount of time learning about these cultural issues is seriously lacking. Now, this publication specifically talks about cancer, so let's talk about how cancer uniquely affects LGBT populations. So we see that they experience a huge difference in surviving and overall health outcomes as it relates to cancer. Cancer survivors who are LGBTQ experience increased levels of distress. We have relationship difficulties and more likely to have substance abuse and just overall worse qualities of life. And in fact, a recent survey of LGBTQ survivors of cancer said that, you know what, my needs were not met, I felt socially disconnected, and I actually had a lot of post-traumatic stress regarding the diagnosis of cancer. Like, this was a big deal for these patients. How can we improve provider competency? How do we educate about specific LGBTQ health issues? And finally, perhaps the most simple is, how do we let providers know that LGBTQ patients need the same amount of education and cancer awareness as everybody else? That, my friends, is exactly where this publication comes into play. And it looks at an online web-based platform for training called Colors Training, and Colors is an acronym which I'll put on the screen. The training involved 3 different cancer centers throughout the state of Florida, and it was developed with LGBTQ community members, as well as content experts about our culture. So this web-based training was broken down into 4 different learning modules. The first being basics on LGBTQ populations, just defining some things, how to communicate, and what type of language to use. The second module was about creating inclusive environments within the clinic or wherever they went to seek cancer care. The third module was about unique communication techniques and strategies to connect with that LGBTQ person. And finally, it was about unique social issues that surround surviving cancer for our population. Each of these modules takes about 30 minutes to complete, and it's complete with interactive learning, and they had 2 to 4 weeks to complete the entirety of the training. Following the training, the providers were then tested on the level of knowledge that they retained. Now, it is a very small study. Only 44 oncologists were actually included, and of them, only 33 completed the training. Of those who completed the training, 88% identified as cisgender and heterosexual, and 95% of them had LGBT friends. At the beginning of the training, they measured the providers' attitudes and their feelings and cultural awareness about LGBTQ issues and just sort of how they felt about our population. They also did the same at the conclusion of the training. And to cut to the chase, the training worked. The providers showed increased levels of favorable attitudes about our population, they all thought that the training was appropriate for their scope of work, and they thought it was really helpful. And in fact, most providers actually want additional training on these types of things. It's just that no one has really come up with a good way to cover all of these individuals. And of course, my argument is that we need to do more of it while we are in graduate school, medical school, while we are younger in our careers, so that it is a foundation of just who we are and who we become as providers. And so, yes, this training worked. It was a good job. They are clearly onto something with this colors training. And my biggest question about this research is, does it actually yield significant results with the patients? Do the patients actually feel a connection with providers who end up going through this training? Is there less levels of distress? Is there more cancer survivorship? And are their needs met? This video comes at a really interesting time for my career because actually next week we are getting a lecture from a content expert about LGBTQ culture, and I'm very much looking forward to it. All right, I love it. That was the topic for today. I hope you enjoyed this week's topic, so please like, comment, and subscribe. It would mean the world to me. I want you to know that if you comment, I will reply. I'm trying to build a community here and show other LGBTQ individuals that we are here, we are in healthcare, and that we are here for you. We will help you out. All right, till next time, bye!